Are you taking prednisone for autoimmune or other hepatitis? If so, you might be looking for a natural substitute for prednisone. And I can completely understand why, because I personally had to take it and it caused so many side effects. In fact, it causes more side effects than any other drug. So if you're looking for a natural substitute, I've got a few things I can share with you today about what the evidence shows for hepatitis and natural substitutes. And the real thing is there's one standout that potentially may help, and then a few that a lot of people talk about, but are probably not effective. This came from the Natural Medicines database. It's got all of the scientific evidence compiled over the decades, and they rank the evidence based on how effective it is for certain conditions. So for hepatitis, they found that one thing was potentially effective, and that is taurine. Taurine is an amino acid that has been shown to be possibly effective for people who have hepatitis. It may improve liver function in people who have acute or chronic hepatitis. Now I want to cover the 3 natural substitutes that are possibly ineffective. First of all is N-acetylcysteine, or NAC. And this is often included in liver cleanses and other supplements that are supposed to help clean out your liver or clean out your gut. And it doesn't appear to improve relapse time. But potentially, if it's taken along with interferon, it may help. It's just conflicting evidence. Number 2, possibly an effective natural substitute for prednisone for people with autoimmune hepatitis is phosphatidylcholine. Now, this is a phospholipid, and the cell membrane is made of a phospholipid bilayer. And so this is potentially to help recover that in the liver. But it doesn't seem to reduce serum bilirubin or liver enzymes in people who have hepatitis. And the third, possibly ineffective supplement for people with hepatitis is St. John's wort. This is usually used to help out with depression and other mood changes, but it contains a powerful active ingredient called hypericin, and it has been shown to be ineffective for hepatitis. So those are the natural substitutes for prednisone and the level of evidence to support them. And if you have no other alternative but to take prednisone and you're thinking, there's got to be something better than this, I felt the exact same way. I personally had to take prednisone for 9 months for an autoimmune condition myself. And in that time, I had an epiphany. I realized that people on prednisone need a supplement designed specifically for them. And so I realized that prednisone is stealing nutrients from our bodies. And so we need to give those back so that we can feel like ourselves again. And so what I did is I compiled all of the best ingredients, all of the nutrients prednisone steals, plus a few to help counteract specific side effects, and put it all in Nutrinizone. Nutrinizone has a bedtime bottle and a morning bottle. And all you do is take your morning prednisone with 2 morning capsules and then 2 bedtime capsules to help you sleep restfully at night. And it will help you so that every single milligram you have to take of prednisone matters, and that you're minimizing the damage that prednisone is doing to you so that you can feel like yourself again while having to take prednisone for autoimmune hepatitis. All you have to do is go to nutranize.com, nutranize.com, so that you can take this along with your prednisone and feel like yourself again. Signing off as Dr. Megan, your prednisone pharmacist.